Welcome to Module 3 of the Disability Inclusive Health Services Toolkit. In this module, we are going to focus on removing physical barriers in health services and promoting universal design and reasonable accommodation. In this first video, we will discuss what is meant by physically accessible health services, why this is important, and some common physical barriers. Physical accessibility can be defined as the availability of good health services within reasonable reach of those who need them, and of the opening hours, appointment systems, and other aspects of service delivery that allow people to obtain the services when they need them. Note the emphasis on good or quality health services within reasonable reach and when needed. This builds on the principle of having flexibility in your service delivery practices and policies to facilitate disability inclusion, as we introduced in Module 2. Whether due to injury, illness, surgical interventions, aging, or disability, most people will experience impairment at some point in their lives. Therefore, accessible and inclusive design in health facilities is of benefit to everyone, not just to people with disability. Physical barriers can prevent people with disability from accessing health when they need it. Removing physical barriers is therefore a key aspect of achieving universal health coverage and providing a disability-inclusive health service. Let us think back to our patient's journey of accessing healthcare and where physical barriers might occur along the way, keeping in mind people with physical or vision impairments in particular, but also how the physical environment might impact people with all types of impairments and create barriers to access. First is the location of health services. Where are they in relation to where people live? How easy or hard is it for people to get to health services? Is there public transport available? Is this transport physically accessible for people with mobility impairments? Is it affordable? Is it easy to get from public transport to the health facility entrance? If people come by car or motorbike, is there parking available close to the entrance? Next, consider the infrastructure of the health facility itself, taking into account barriers that could restrict movement in and out of and within buildings. Inside the health facility, consider the impact of furniture and equipment on physical accessibility, including reception areas, examination tables, or diagnostic equipment. And finally, consider amenities such as toilets, drinking water, and hand washing facilities. On the next two slides, we have listed some common physical barriers that occur at health facilities, many of which can be addressed without great expense. These common barriers include uneven pathways leading to the entrance of health facilities, or pathways that are too narrow to accommodate a wheelchair or other mobility device. Steps at building entrances or within buildings without access to a ramp or elevator as an alternative. Ramps that have been installed, but they are blocked by motorbikes parked on them or other obstacles, or they are of too steep a gradient to be easily accessible. Doors that are very heavy and hard to open, or door handles that are too high or difficult to manipulate if you have reduced strength, and doorways that are too narrow for wheelchairs are all common barriers. Inside health facilities, common barriers include reception desks that are too high for people in wheelchairs to see over, a lack of accessible toilet facilities, or accessible toilet facilities that are available but are kept locked or are not maintained, making them unusable. Furniture that blocks hallways and access in waiting areas, or does not allow people with mobility devices to maneuver themselves in consulting rooms, are further common physical barriers. Drinking water and hand washing stations that are at inaccessible heights or in hard to reach locations, and a lack of height adjustable examination tables can also make accessing healthcare challenging for people with disability. Think about your own health service now. Are any of these common physical barriers present in your health service? Can you think of any others? What do these barriers mean for people with disability to easily and safely navigate to where they need to go within your health facility, communicate with staff, and transfer on and off examination tables or diagnostic equipment? How does this affect their ability to get the healthcare that they need? So what do we mean by physically accessible health facilities? Physical access to health services is crucial to people with disability, and accessibility must be considered in all places in which health services occur, which includes not only clinics and hospitals, but also anywhere that health promotion, prevention, or treatment activities occur. Physically accessible health facilities enable people with disability to use them safely and with ease and with dignity. They are easily reached, they are affordable, and this includes the transport to and from health facilities. Accessible health facilities provide flexibility with appointments to allow people to obtain services when they need them or when a support person can attend with them, which may be outside of usual business hours or in alternative locations, including a home visit. Physically accessible health facilities allow people with disability to enter and move around the buildings easily and access all necessary areas and amenities. Please return now to the workbook and complete the activity in step 3, where we will examine some scenarios where attempts were made to provide physical accessibility, but where they did not get them quite right.